Hi guys, Dr. Huntington here with diabetes fact number 2 of 100. In this video, I'm going to show you why a person with insulin resistance has trouble controlling their blood sugar. It's simple. In a healthy condition, you eat food which your body digests. Now there are many things that your body gets from the food that you eat, including vitamins and minerals and other nutrients. Now certain kinds of food that you eat can be broken down into glucose, which is a sugar that your body can use for energy. This glucose from certain kinds of food will raise your blood sugar. This rise in blood sugar is literally the glucose sitting in your blood, but it's not supposed to stay there. As a response to the rise in blood sugar, your body produces the hormone insulin, which will help to push the sugar out of your blood and into your cells where it can be used as fuel. So insulin lowers your blood sugar by pushing it into the cells. That is what is supposed to happen. Now let's look at what happens when there is insulin resistance. So I've got a diagram here. Food goes into the body and is digested. As mentioned earlier, it's broken down into vitamins and minerals and other nutrients. But certain kinds of food can be broken down into glucose. And glucose, again, is the actual blood sugar. And so that glucose causes your blood sugar to rise. Now, in response to that rise in blood sugar, your body secretes insulin. So there's an increase in the amount of the hormone insulin in your body. And the purpose of insulin is to push that blood sugar into the cells. And here's how it happens. I've got a cell down here. I'll label it for you. So here's a cell. And one of the structures on a cell is called a receptor. So it's this Y-like structure. I've got 2 of them on this particular cell. And that's part of the cell communication network. It's how the cell talks to the outside world, other cells, and the rest of your body. So what I've got on this diagram here, outside the cell, here's inside, here's outside. These red dots are glucose, and the black triangles are insulin. And what happens here is the insulin matches up with the receptors on the cell. You can see they sort of fit in there based on my diagram. And when things are working properly, the glucose goes in there, or the insulin goes in there into the receptor and tells the cell to open up to allow the glucose to go in. And that glucose then can be used for energy. But in insulin resistance, we'll close up our cell here. For some reason, the insulin is not able to match up effectively with the receptors. So there's a communication problem here, which is causing a situation where the cell is then not opening up and accepting the glucose. So you end up in a situation where the glucose stays in the blood. And of course, that's a problem, because when the glucose stays in the blood, that's when you end up with high blood sugar, and your cells end up not getting the glucose that they need to produce energy, because the sugar is staying in the blood. So you end up with the damaging effects of high blood sugar, along with the fatigue that can accompany the fact that your cells are starving for energy. Remember, this condition, insulin resistance, is the best indicator that a person will develop diabetes 10 or 20 years down the line. And it's also linked to many of the other major chronic diseases that people suffer from today. In an upcoming video, we'll discuss some of the causes of insulin resistance and how it can lead to a diagnosis of diabetes.